Hello, this is Dr. Ronald Guberman. I'm the co-director of the Podiatry Division of the Department of Surgery at Wyckoff Heights Medical Center. I'm coming to speak to you today about winter-related foot and ankle injuries. If you have any of these conditions, we have inpatient and outpatient treatments available for these services, which include our podiatry clinic, our emergency room, and our wound care center and hyperbaric treatment center. Now we're going to discuss some common injuries and conditions of the forefoot or the front of the foot. So you will often see on the toes, you can develop blisters or corns on the toes here or there. On the bottom of the foot you can get calluses. Blisters can develop all over the foot. Of course, we discussed already ingrown toenails. You can also develop ulcers, especially people who are diabetic or have poor circulation develop ulcerations or loss of the skin in any part of the foot, including the toes. So if you develop any of these conditions, you should definitely seek medical attention. Especially if you're diabetic or have poor circulation, you should definitely seek it on the same day that you notice it. For others, they may be able to wait and make an appointment with our clinic, but for someone who has a serious condition where you notice that there's pus draining or that there's a lot of redness in the toes or in any part of the foot, you should definitely come in right away and consider coming to the emergency room for those types of conditions. We also want to discuss the fact that shoe gear can play a big role in developing these conditions. Now, the changing of shoe gear, especially in wintertime where you're wearing hard or close-fitting shoes and boots that maybe are not as forgiving as your summer footwear, can cause these conditions that I've already mentioned, the ulcers, the corns, and the calluses to develop. And it's important that you examine your shoe gear, and if you see anything that is not fitting properly, or you see any redness or irritation, or you feel any pain, that you should definitely consider changing them, not using those, and if you need to consult with your podiatrist that can help you determine what is the appropriate shoe gear for you. In the wintertime, as we were discussing about excessively dry skin, is to regularly moisturize parts of your body, and especially the feet when they become very dry, in order to prevent this cracking of the skin and also just the general dry appearance of it. So you can moisturize twice a day without a problem for most people, and that's generally very helpful. Another thing, as we always discuss, is with people who are diabetic or who have lack of sensation in their feet due to other conditions that may cause that, or people who have poor circulation, have to be very careful with getting injuries or infections and should seek medical attention very quickly if any of these things happen. Diabetics who have diabetic peripheral neuropathy, which may involve loss of sensation to the foot or part of the foot, should be especially careful in the cold, and also if they come in from the cold, from applying heat to the area to warm it up. Sometimes, being diabetic, you might not be able to feel exactly how hot the water is that you may want to soak your feet in, or a hot pack is, and you can actually burn yourself. And we see this very, very frequently, that these type of injuries occur that are self-inflicted because the person didn't feel it. So if you're going to soak your feet at all as a diabetic, you have to make sure that either you or someone else who can feel the water with their hands, that the water is lukewarm and not hot. And use of things like heating pads is generally not recommended for diabetic patients or people with poor circulation for these reasons.